Much like a cancer diagnosis affects every aspect of the patient's life, the pathophysiology of testicular cancer intertwines closely with many of the topics covered in this course. Today we will cover stress and disease, gastrointestinal disorders, and lung disorders caused by cancer and its treatment. In the study of cancer, it is necessary to first review cellular adaptations to stress that we covered in this course. While we don't know what causes testicular cancer specifically, we do know that the mutation that occurs on chromosome 12 renders the cell resistant to apoptosis, or programmed cell death. This means that the neoplasia, or rapid growth of abnormal cells, goes unchecked, and these are the cells that grow into a testicular tumor. This does not mean that our body doesn't put up a fight. Think back to the relationship between stress and disease. Stress activates the sympathetic nervous system, shifting the focus away from things like digestion or rest, and most importantly in this case, immunity. Cancer is already very confusing to the immune system, since not all malignant neoplastic cells have an identical abnormal membrane. Stress essentially weakens our first line of support against cancer when we need it the most. Therefore, while it's difficult to prove that lack of sleep or a stressful job could be the cause of cancer, it's reasonable to argue that these stressful conditions could provide the environment necessary to support cancer growth. Other ways in which the effects of cancer integrate with topics of physiology come along with cancer treatment, mostly in the form of chemotherapy drugs. Chemo consists of specific regimens of anti-neoplastic drugs that will do well to kill cancer cells, but not without harming healthy cells as well. Because cancer cells grow and divide quickly, the target of chemo drugs are the fast-dividing cells in the body. In addition to causing hair loss, skin irritation, and mouth sores, chemo also destroys gastric epithelial cells, which can cause gastrointestinal problems in 50 to 80% of cancer patients. That's a high number. Chemo-induced diarrhea is the result of acute damage to the intestinal mucosa, including loss of intestinal epithelium, superficial necrosis, and inflammation of the bowel wall. This causes an imbalance between absorption and secretion in the small intestine, as we discussed in our gastrointestinal disorders section of this course. Now, our last topic of integration relates again to the imbalances chemotherapy drugs can cause in the body. One of the chemo drugs that is crucial to the treatment of testicular cancer is bleomycin, an anti-tumor antibiotic that interferes with DNA synthesis. Like many chemo drugs, it has a long list of adverse side effects, but one of the most severe is bleomycin-induced lung damage. The mechanisms of this lung damage closely parallel those we studied in our respiratory disorders module. Recall how in emphysema, smoking can cause pulmonary inflammation and damage of the alveoli. Bleomycin can elicit a similar inflammatory response, breaking down the membranes and healthy tissues in the alveoli and causing permanent damage in rare cases. This concludes the integration section of this pathophysiology project. While the list of symptoms affected by cancer and its treatment can go on, it's useful in the scope of cancer research to take a small sample of how other body systems are affected by the disease. Thank you so much for watching.